Washington Journal continues.
And meet Congresswoman Diane Black, a Republican of Tennessee. In Congress, she's a member of the Budget Committee. She's also on the Tax Writing Committee, Ways and Means. Her district is the 6th in Tennessee. That's the area around Murfreesboro and Gallatin, Tennessee. And she's part of the Tea Party coalition in Congress. And we have lots to talk with her about this morning. Good morning. Thanks for being here.
Good morning. It's good to be here with you.
I'm going to start with an issue that you're very much involved in because it so much affects the big discussion going on about the budget and the budget deficit, and that is Medicaid spending. You have a proposal right now regarding Medicaid eligibility. Talk to us in broad terms about how much money this country spends on Medicaid and why it's an issue you're concerned with.
Well, when we look at the cost drivers of where we are in our total budget right now, we know that Medicaid is one of the top cost drivers. And we want to be sure that we do take care of people who are the neediest of the needy. And so therefore, if dollars are limited, you want to make sure that you're using your dollars where they really are meant to be used, and that is in Medicaid. And that's what my bill does, is it makes sure that this is a fairness issue, that we are taking care of those who truly are in need.
Looked at the state numbers about Medicaid use and eligibility, and since the recession, the number of people applying for enrolling in Medicaid has gone up dramatically. In fact, Medicaid enrollment here is the Kaiser Commission increased nationwide by 7.2% or 3.37 million between June of 2009 and June of 2010, exceeding 50 million enrollees for the first time in the program's history. Medicaid enrollment has grown by 7.6 million since the start of the recession in December 2007. Interestingly, it looks, if I read this correctly, like the only state that hasn't seen a growth in enrollment is your own home state. Is that true?
We know that Medicaid does go up in those times where economy is bad. When people have jobs, obviously their income level goes down and they then can qualify for the program. We have not seen a significant jump in Medicaid in our state, and some of that people relate to the possibility that we are a volunteer state where we actually help one another in other ways besides people applying for state Medicaid assistance. And so churches and neighbors and so on are taking care of one another, and we haven't seen a sharp increase in our Medicaid in our state.
So just walk us through your thinking about this. If more people are enrolling because they don't have jobs and find themselves in perhaps a more anxious state than they have in the past, and you're coming at this from eligibility, does that mean that there will be more people without jobs, without access to health care as a result?
No, we're really actually coming at this from a point of where there was a glitch in the law, whether there was a intentional or just an unintentional. There is a glitch there, and it does place people that are at a much higher income level than in most other federal assistance programs, such as food stamps and housing and SSI. And we want to make sure that there is an alignment in these programs so that someone that is at the income level of a middle class where they really don't need that assistance is not getting that money, because, as I say, if they're getting the money, then we know that the money is not going to be there for people who are the most needy.
So this is a portion of the President's health care law?
This is.
Yes. And your overall position about the President's health care law has been pretty critical.
Yes, it has. And I do believe that if we could repeal and start all over again, there are lots of good ideas out there that would cost us less money. Be sure that we do give more access, and that was really the purpose of the health care law, was to give greater access for a lower cost. And what we're finding as more and more of that 2,700-page document is being written, that it is doing neither of those things, giving more access nor lowering the cost. And so I have been critical and would like to see, and it was my first vote, to repeal the Patient Affordability Act, or commonly known as Obamacare. And I still believe today that that really is the thing to do. There are, as I say, other very good ideas out there to make health care more accessible at a lower cost.
Representative Black comes to the discussion about health care from a professional point of view. Before coming to Congress, she began her career as an emergency room nurse and served as a long-term care nurse and worked as part of the outpatient surgery team in her home state. She's a graduate of Belmont University with a Bachelor of Science in Nursing, and she also served in Tennessee's state legislature, both as a representative and as a senator, before coming to the U.S. House of Representatives. We'd like to get to your phone calls for her pretty quickly, and you can also, as you know, send us a tweet or send us an email. We'll put all of those communications modes on the bottom of our screen so you can join.